Hello and welcome to a special soundbite edition of the Physio Matters Podcast, brought to you by IFOMPT 2016. I'm Jack Chew, and over the coming months, more and more content shall be featured on the IFOMPT Media YouTube channel, including podcasts with all keynote speakers. So let's get to this one with Dr. Jeremy Lewis. Good morning, Jeremy. Would you like to introduce yourself?
Hi, Jack. Thanks for the opportunity for this to do this podcast. Yes. So my name's Jeremy Lewis, and by a quick way of background, I was born in New Zealand and grew up in Australia, came to live in the UK for a year, about 14 years ago, and my wife and family have been here ever since. And since living in the UK, I've worked in a number of NHS hospitals, and I currently work in two NHS establishments. I work for St George's Healthcare in South London, Southwest London, and I also work for Central London Community Healthcare in London as well. I also work for two universities, two university appointments. I work privately for the Centre for Health and Human Performance in Central London, and that keeps me off the street for most of the week.
Fantastic. Yeah, that sounds busy.
Yeah, it's busy. I also do quite a lot of teaching. I've had the privilege to be invited internationally to teach a couple of courses, and that's also a little bit part of what I do. But my most important job, of course, is being a father to three lovely girls.
Of course, yeah. And I'm sure that's the thing that keeps you most busy.
Yeah, well, that's the best part of the week.
And I imagine that a broad and varied experience has led to a broad and varied skill set. So what are the key parts of your career journey that's led you to where you are now?
Well, that's a good question. I guess my philosophy is that there's that John Lennon line, life is what happens when you're busy making other plans. And early on in my physio career, I was very interested in neurological rehabilitation, but had the opportunity, after travelling around Australia a little bit to doing some locums, to work in some musculoskeletal practices, and I became quite interested in musculoskeletal medicine and how musculoskeletal problems affected people's lives, and then started a journey gaining knowledge and acquiring skills to treat musculoskeletal problems. So after my undergraduate degree in Melbourne at Lincoln Institute, which is now called La Trobe University, I did a one-year postgraduate minute therapy course in Melbourne and supplemented that the year later in Western Australia at Curtin University with a postgraduate diploma in sports physiotherapy. That, when I came to the UK, then was supplemented with a postgraduate diploma in biomechanics at Strathclyde University in Glasgow. So going to the Glasgow IFOMPT conference is an opportunity to revisit Glasgow after many years.
Of course.
And I've also done a postgraduate certificate in diagnostic ultrasound at Leeds University, a master's somewhere else, a master's at Coventry University, and a PhD also at Coventry University. And that skill set, I guess, was just has been a work in progress my whole career, trying to just gain more knowledge, more skills, better understanding, to try and understand how better to contribute to the patients who are seeing with musculoskeletal problems.
Fantastic. And when did it become, because you're best known really for your work around the shoulder. I mean, there are many other clinical areas that you work within, but when did that occur? When did you specialise more particularly in the shoulder joint?
I sort of found it very hard to keep up to date with all the different musculoskeletal areas, and I guess about 15 years or so ago, maybe even slightly longer, my two main interests were around the foot and ankle and the shoulder, and I had an opportunity to work with some unbelievably fantastic clinicians from a variety of health professions, from orthopaedics, physiotherapy, osteopathy, dealing with shoulder-related problems. And I guess at that point in time, I decided that I'd concentrated on the shoulder, and that's where I started to do more research. And my PhD was around, at that stage, something called shoulder impingement syndrome, looking at postural influences in that condition. And that's where my career sort of really focused on the shoulder for about the last 15 years or so. This is most of my research interest. most of my clinical interest, where I'm supervising PhD students, master's students. The whole focus has been around the shoulder and tendon injuries, tendon issues around the shoulder. And with one slight variance, we just finished supervising a PhD student Sian McRae, who's done her PhD looking at the influence of footwear in low back pain. That was a paper published in Spine.
Fantastic. So yes, there are some variants there, but some of your elements of your practice quite highly specialised. You mentioned sonography, for example, but from what I gather from your lectures and your writing, you do seem most passionate about influencing the frontline coalface practice. Is this fair for me to say? And if so, what parts of your work are you most proud of?
Okay, it's a very interesting question. It might take a couple of years to answer it.
Another tempting cliffhanger. Head over to IFOMPTconference.org to register your inevitable interest in the event and to get the full version of this podcast. Choose Health and the Physio Matters Podcast are supporting IFOMPT 2016 because physio matters. Bye for now.